Hello friends, welcome to my channel Rairori World. Today I am here with the topic Nosocomial Infection or the hospital acquired infection. Before we get into the topic, let me give you a brief introduction about what is nosocomial infections. So these are infection which is acquired during the process of receiving health care. They can lead to the increased stay length of infected patients. So, during hospitalization, the patient is exposed to pathogens through different sources like environment, healthcare staff, and infected patients. So, we will discuss about factors, sources, mode of transmission, and prevention and control of hospital acquired infection in this video. Now, coming to the definition. So, the infections developing in patients after admission to the hospital which were neither present nor in incubation at the time of hospitalization. Such infections may manifest during their stay in the hospital or sometimes after the patient is discharged. So, there are certain factors which are mainly the cause of hospital acquired infection. Among them is the age. So, it is mainly affecting the infants and the elderly as their immune system has not developed properly and in elderly it is not functioning properly. So this combination of increased condition and decrease in activity of the immune system can make people more prone to the infection. The next is the infected patients which can spread infection to their close contacts, drug resistance, occurrence of drug resistant organisms, susceptible patients, surgical procedures and hospital environment. Now, coming to the sources. The sources can be endogenous sources, exogenous sources. So, what is endogenous source? So, endogenous is a self infection with a patient's own overgrowth of bacterial flora. And exogenous is an other person in hospital or contaminated item of an equipment. So, the sources can be the commensal flora of the patient, the medical instruments, the hospital patients, and also the contaminated hospital environment. Now, coming to the mode of transmission, the first thing can be the contact route, so which can be either direct or indirect contact. So, the infection can transmit from another host or from an environmental reservoir by direct contact. And indirect, the transmission is a common mechanism of transfer of an agent of nosocomial infection. So, the contact route can be either through an equipment, instrument, or healthcare staff. So this is regarding the contact route. Coming to the airborne route, so within hospitals, infective dust and aerosols, infected or colonized patients, staff or visitors, and ventilation and air conditioning can lead to the airborne route. So purifying the air to reduce the risk of airborne transmission can prevent the hospital acquired infection. Next is the oral route. So, the oral route can be transmitted through the hand mouth route, respiratory route, fecal oral route. So, these are the three types of route which can be spread through the oral route. Coming to the parenteral route, so it is the exposure or penetration of sharp objects or instruments into the skin or mucous membrane which may be contaminated by blood tissue or potentially infectious body fluids. So these are the four mode of transmission of nosocomial infection. Now coming to the most common infections which is caused by the hospitals are the first is the urinary tract infection which covers about 40% of the infection. So it is a common complication in surgical patients and is primarily related to the use of indwelling urinary catheters. So discontinuation of the catheter usage within 2 days whenever possible is a cornerstone to avoid these type of infections. So it is frequently caused by multi-drug resistant pathogens such as Staphylococcus, Enterococcus, E. coli, Pseudomonas, etc. Now coming to the lower respiratory tract infection, which covers about 15 to 20% of the infection. So the nosocomial pneumonia is the second most common hospital-acquired infection, and it is also the leading cause of death in the hospital-acquired infection. So the MRSA is a type of bacteria that is resistant to several widely used antibiotics. So this MRSA is also called as a superbug. So it can reach the lower respiratory tract to cause the pneumonia. Now, coming to the bacteremia. So, most nosocomial bacteremia occur endemically and are the secondary bacteremias caused by the post-operative wound or intra-abdominal infections. So the bacterial invasion of bloodstream can occur by contaminated intravenous cannulas. So most gram-negative bacilli are also involved in the bacteremia. So the primary bacteremias most frequently originate from the intravascular devices. Next, coming to the wound infection. So, it is a surgical site or the bloodstream infection occurring after 48 hours of operation until the time of discharge from the hospital with clinical signs and symptoms along with the laboratory confirmation. So, most wound infection manifest within a week of surgery, and non-surgical wounds can also develop nosocomial infection. Some of the organisms involved are Streptococcus, Clostridium tetani, Staphylococcus, and gram-negative bacilli. Now, coming to the hepatitis B and C, the healthcare associated transmission is the second most common is the HBV and HCV transmission route. So, here what happens is the reuse of needles and syringes was a mechanism for the patient to patient transmission of HCV and HBV. So now coming to the tetanus. So tetanus spores are present throughout the environment. So which can occur as a case of nosocomial post-operative tetanus. So due to contaminated dressings and improper disinfection can lead to tetanus. Coming to acute gastroenteritis. So it occurs during prolonged stay in the hospital. So it is a non-infectious and is most commonly happening in the hospital infection. So nosocomial diarrhea is a diarrhea that develops during hospital stay or up to 3 days after the discharge. So it is caused mostly by the adverse effects of the drugs or surgery of gastrointestinal tract. So now coming to the measures to control and prevent the infection in the hospital, an infectious patient is first isolated. Then, administration of antibiotics is given to the patient, and proper sterilization and disinfection of inanimate objects is being done. Transmission route controlled by regular hand washing and change of working clothes. And finally, the susceptible host is protected by vaccination. So, in order to control and prevent infection in the hospital, there is an infection control committee that is being formed in every hospitals. So, the infection control committee functions to prevent and control the healthcare associated infection by setting an infection control policy and monitoring practices to reduce these risks. So, the team mainly advises on prevention, surveillance, investigation, and control of infection within the board. So, the Infection Control Committee mainly includes members from a variety of disciplines within the healthcare facilities. So, it can be the chairperson, member secretary, which can be a microbiologist, and members which can be from all departments. So, now the importance of the Hospital Infection Control Committee increases every year due to the emergence of the multi resistant bacterial strains and the hospital outbreaks and many other factors that can cause the hospital infections. The Hospital Acquired Infection Control Committee must meet at least once in every month to formulate and update the policy for the whole hospital. So this is all regarding the nosocomial infection and hospital acquired infections. If you have any queries regarding this topic, you can pin me in the comment box. Thank you for watching the video. We'll come with another topic in the next video. Till then, bye. Subscribe my channel. Thank you.